All right, good morning, everybody. I'm Nicole Johnson, Director for the Partners in Health and Wholeness Program at the North Carolina Council of Churches. We are glad to have you with us this morning. We have not had a legislative seminar in person since 2018, I think. And so it's been a little like, what's happening? Do we remember what to do? So far it's working out. So welcome to Bringing the Parable of the Good Samaritan to Life, Improving Drug Policy in North Carolina. And we're excited to have with us this morning Randy, Roxanne, Jordan. And Jordan is an experienced facilitator, consultant, and peer worker. She currently works as a peer supervisor with Recovery Link and a field organizer with the Pennsylvania Harm Reduction Network. Currently, Randy serves on the steering committee for Care for Carolina, whose only mission is to close the insurance coverage gap in North Carolina. He is the planning committee chair for the International Overdose Awareness Day, North Carolina Raleigh Remembrance Event. He is the state director of the National Coalition Against Prescription Drug Abuse, a regional outreach coordinator for parents of addicted loved ones, and is a member of the Expand Good Sam NC Coalition. And Roxanne is a consultant with Open Society Foundations focused on promoting harm reduction and good drug policy. She has 15 years of experience working with grassroots groups to advocate for effective overdose prevention and response, evidence-based treatment, and human rights-oriented drug policies, both in the U.S. and internationally. Today's workshop is going to be focused on discussing developments at the legislature related to drug policy in North Carolina. This year, our nation and our state has seen a record number of drug overdose deaths. Twice as many people now die in the United States from overdose than died at the peak of the AIDS crisis. In recent years, many have declared that we cannot arrest our way out of this problem. Yet at the very same time that overdose death rates amongst Black and Indigenous people have overtaken rates among white people, we are seeing a return to punitive approaches to dealing with this health issue. And so they're gonna discuss in kind of as an Oprah style format, you called it this morning, Roxanne. They're gonna be talking about some of our drug policies in North Carolina. So welcome. You can say more about yourselves if you'd like to.
Yeah. Thank you, Nicole.
Thank you.
We have some slides here, so I'll just advance to the next slide because we wanted to talk a little bit about, before we get started, our why, for why we're involved in this work. All of us are part of what we call the Expand Good Samaritan NC Coalition. So maybe Jordan, do you want to start, just say a word about that before we move on?
Sure. The first three pictures are my biggest why. First picture is my cousin, Anika. She passed in the spring of 2021. She sat in the coroner's office unidentified for 2 months before we were made aware that she had passed. The next picture is my friend Hillary. She passed in 2009 before there was a Good Samaritan law in Pennsylvania. She died from a combination of heroin and Xanax and was with her partner at the time. And he was scared and he fled the scene and she died alone. Last picture is my brother Will. He passed in February of 2013. Shortly, right around the same time that Delaware was working on passing their Good Samaritan law. Again, he was not alone when he was using drugs, but he was alone when he died and he passed. They are just three of the dozens of people that I have buried since I was 16. I've been going to funerals and saying goodbye to my friends for 2 decades now.
So if we continue across, I have to say the person up here in the corner with the great big smile, that's my daughter, Vanessa. The message this morning really was very special to me. Pastor mentioned people deserving, to have the best, pretty much no matter what. That was a way my daughter lived. She believed that everybody deserved to have the life that they dreamed of, no matter what. She died in January of 2015 from an overdose when the group she was with at a party panicked. They didn't call 911 immediately, and had they dialed 911 immediately, I may not be here, which would be perfectly fine with me. But that was just the type of person she was. She would go out, and if she saw someone on the street corner collecting, money, a homeless person or whatever, try not to label people now, she would go buy their lunch. But when she brought it back, she wouldn't just give it to them and go on. She'd sit down and eat with them. The two in the bottom corner, Boone Cummins and Sean O'Donnell, are the sons of two of our coalition members. Julie Cummins and Mary O'Donnell. They were best friends, and they died roughly about a month apart. Both had been out with friends, partying, passed out, and subsequently fell into a lake at a rock quarry and drowned. So their deaths were not directly related to drug overdose, right? But their friends also sort of panicked because they were all underage. So they didn't dial 911. They didn't call for help.
And then in the bottom corner here, two of my mentors, Mark Kinsley and Dan Bigg. Dan Bigg was, many people are familiar with the drug naloxone. It's a medication that's used to reverse overdose. Dan was the person who took that out of the hospitals and started giving it to lay people. He was the first one in the U.S. to do that in 1996. He really thought that people who use drugs should be empowered to save one another. And the irony is that in 2018, he himself actually died of an overdose. He was somebody who taught me a lot. And, I was doing this work before he died, but his death really spurred me on to double down and try my hardest to reform drug policies. Mark Kinsley, similarly, is somebody who was a leader in this work nationally, especially a leader in work around people who use stimulants, and he died of an overdose last year. So those are two of my mentors, and just like to be able to recognize them and remember them as we carry on with this work. Just really quickly to go through the agenda. We'll talk briefly about overdose in North Carolina, where we are today with those figures. And then we'll talk about something the three of us are very passionate about, which is this campaign we have to expand North Carolina's Good Samaritan law, kind of what we're trying to do and why. We'll talk a little bit about some of the other policy proposals that are at the legislature right now. Unfortunately, most of them punitive. And then we'll have a little bit of time as well for questions and answers and discussion. Okay, so this is a slide that is the latest figures from the Department of Health and Human Services of overdose in North Carolina. I think, my big takeaway from this is that we have an all-time high in this state of overdose, similar to this country right now. Last year, 4,243 North Carolinians died of overdose, so that means about 12 people a day. So that's higher than ever. A lot of this has to do with fentanyl. As was mentioned, and it's in a lot of the drug supply right now, including in stimulants where people might not be expecting it. Fentanyl is an opioid, so stimulant users might not be expecting fentanyl in their drugs. So as we mentioned in the introduction that in the U.S., the highest rates of overdose are now happening amongst Black and Indigenous people. Often the face of this epidemic, when people have talked about it, has been white people, but that has changed. And now the highest rates are amongst Black and Indigenous people. In fact, last year, the rate of overdose amongst Black people was 27% higher than amongst white people. So that really is shifting those demographics. And the most disparity is in areas with the highest economic inequality. So there are multiple solutions to this issue, including things like better access to physical and mental health care, things like harm reduction and access to drug treatment, and also changes in drug policies, which will, we think can help reduce the number of overdoses. So we're going to talk first about one of those, which is the Good Samaritan Law, which was in the title of our session. So, Good Samaritan laws are laws that are meant to protect somebody who provides help in an emergency situation. And in North Carolina, we have an overdose Good Samaritan law, and it was passed in 2013. It was one of the early Good Samaritan laws, overdose Good Samaritan laws in the country. And so we were a trailblazer in that regard. But since then, a lot of other states have passed laws and improved upon our law. So our law is now kind of behind and outdated. So what our law does is it protects the overdose victim and the person who calls for help in an overdose emergency, those two, from certain crimes. And it's possession of certain drugs like cocaine or heroin up to 1 gram. And it protects from prosecution, but not from arrest and charge. So you can see kind of some of the holes that our law has. It doesn't cover a wide variety of drugs, especially now that fentanyl is so common. It doesn't protect others on the scene who may be helping, and it doesn't protect people from getting arrested, even if they are ultimately not prosecuted. So we're going to talk a little bit about some of the changes that we want to make. So Jordan, do you want to talk a little bit about why it's important to give immunity for possession from a wider range of drugs and drug crimes?
So first, when we talk about the drug itself, currently our drug supply is evolving at a rate that we've never seen before. With whether we're talking about adulterants being added like xylazine or some type of benzo, or the emergence of fentanyl, and there's fentanyl analogs that are slowly popping up. So we need to protect against all illicit substances, because unfortunately the drug supply is going to continue to evolve, and because it's going to take time for us really to get a handle on the evolution of the drug supply. So it needs to cover everything. And then for protecting people at the scene, so whether we are talking about the teenager who is just beginning to experiment, or the weekend partier, or the daily drug user. So we look at teenagers, they're scared. I'm at a party, we're experimenting. I can't let mom and dad find out. As a teenager, I was terrified of my mother. I honestly would have rather gone with the police than my mother be called, right? And even, the weekend partier. Say you're in a profession, like you're a nurse, or you're a teacher, or a doctor, or a lawyer. You don't want it to get out that you use drugs on the weekend. And, especially for daily drug users, I know for me, when I was in my, active problematic use, my biggest fear was getting arrested. And honestly, it was because of the withdrawal that I knew I was going to face. And with the drug supply evolving, becoming more potent, the different adulterants being added, it has further complicated and enhanced those withdrawal symptoms. And contrary to the popular narrative, you can die from complications of opioid withdrawal. We're seeing it happen in jails. People are dying because they are severely dehydrated or other complications. And we also know how drug users are treated in certain settings, how they're treated in jails and prisons, how they're treated in the hospital system. So that fear of being arrested, not having your withdrawal symptoms managed, being thrown into a solitary confinement cell, stripped of, your clothing and left there, that's terrifying. So And even though people currently are ultimately protected from prosecution, that beyond the fact of arrest and withdrawal, there's also, if I can't afford a lawyer or I can't post my bail, I'm going to stay incarcerated until my court date. So especially our, drug users of all kinds, if they are unhoused, don't have money, aren't economically stable, they're going to be affected the most. It puts people in a position where they may lose their children. If I'm a single parent and I've been incarcerated, well, now children and youth is going to step in. Especially if I don't have family to take my children, or I could lose my job. There's this snowball effect. And there have been studies done that show that the strongest Good Samaritan laws are the ones that protect from arrest, charge, and prosecution. And in the states who have amended their laws to protect from arrest and charge, there's more people calling for help and going to get aid because they know. And at the scene of the overdose, we don't want people fleeing a scene that are under the influence, and they could hurt somebody else. There's so many variables at play when we call overdoses. So just that broad protection is really important, and that's what's going to help us significantly decrease preventable overdose deaths, because every overdose death was preventable.
Thanks, Jordan. Randy, do you want to talk a little bit from your own personal perspective about why some of these updated provisions are key?
Yeah. I'm trying to think about our outline here, so I don't talk about things that we're going to talk about later, which I may, and if I do, I'm sorry. But I mentioned with my daughter that the group she was with panicked, and a big part of that was confusion. What Jordan just explained is exactly what happened. They panicked. There was a group there. They did not have Narcan. Which we were just starting to really talk about Narcan.
Narcan's another name for naloxone for anybody who doesn't know.
Does everybody know what naloxone is? It's a reversal drug that can reverse an opiate overdose. So,
but not everything. I mean, it can't reverse it like other
drugs. No, it's just opiates.
Yeah.
Right. So heroin, fentanyl.
Right.
Right. So they did not have that, and my daughter's overdose was a heroin overdose. But it's important to get these laws in place, but not only to get them in place, but make them clear so that people understand what the law is and why it's there, and that they are protected, right? There are laws, if I talk about the death by distribution laws, am I out of order here?
You can do it.
Am I good? Okay. So there are laws that are coming through legislature right now that are referred to as death by distribution laws. And basically what that does is, Laura, I'm going to pick on you, but let's say you and I are friends and we decide we're going to go to a party one night. I bring drugs to the party and you and I share them. Unfortunately, one of us overdoses and dies. I don't want to die yet, so I'm going to say you. But but with that, and I say that lightly, it's really not a joke, but I can be arrested and charged with murder. Even though we just shared those drugs, we knew before we got there we were going to share those drugs. And I only had a small amount. It was just enough for us to use. But unfortunately, my friend overdosed and died. Those laws are counterintuitive to what we are trying to accomplish. So that's why getting a Good Samaritan law, a strong Good Samaritan law in place, but publicizing it and getting people to understand what it means and that it's there is just so important. People did leave the scene when my daughter overdosed. They took all kinds of paraphernalia and drugs and all sorts of stuff and put them on the back seat of her car. Mm-hmm. And we know that happened because no one would leave drugs sitting openly on the back seat of their car, right? And the detectives were able to question people that had left the scene later, and they found out these answers. So with that said, you know, those people that left the scene were putting other people in danger, potentially. Not to mention just putting those drugs on the back seat of the car. They were trying to put all of the blame on my daughter. She had a substance use disorder. Hers was not to any specific drug. It was to whatever made her feel better today. So
yeah, this is just a graphic that shows the substances that are implicated in overdose deaths in North Carolina in 2021. So given that our law protects for up to 1 gram of cocaine and heroin, you can see fentanyl is involved in a lot of the overdose deaths, you know, about 75% in 2021. People know that if they're found with they know that fentanyl is in most opioids, and they know that if they're found with that, they will not be protected under the Good Samaritan law. You can also see methamphetamine is implicated in about 25%. Any stimulants are in quite a few. These are also not protected under the Good Samaritan law. So it just, you know, it makes a lot of common sense to update the law to include the drugs that are most often involved in overdoses.
Quick question.
Yeah.
When you said death by, was it association?
death
Death
by
by
distribution.
Distribution. Does that require an exchange of payment?
So this is what's interesting, and we're going to get to this in just a minute, but we can answer your question now. Under the current North Carolina law, yes. So we passed a death by distribution law, North Carolina did, in 2019. And under that law, there would have to be some kind of sale. Often that is actually like people pooling money, like, you know, Jordan's going to go pick up the drugs, like I give her we pool some money together, she picks up the drugs. Like that, there are all sorts of situations which can count as a sale, even if it's not like a traditional drug dealer, drug user type of situation. This proposal that is at the legislature right now would broaden that definition to not require a sale, but just distribution, so sharing, as Randy explained. So that is, yeah, that's one thing we're going to talk about in a minute, but it has the potential to kind of sweep up a lot more people in that definition of somebody who could be charged with death by distribution. So just to quickly go through these, this is, we talked about the need to protect everybody at the scene, not just the person who calls in the victim. This is a graphic from a CDC guide that, you know, talks about the importance of this as best practice. You know, there are lots of ways in which people help, whether it's one person might be calling 911, one person might be administering naloxone, somebody might be doing rescue breathing, somebody might just be like providing moral support to the people who are doing that, because it's a very scary situation, right? So, you know, I think in Vanessa's case, people were taking time to think about like who, like if they should all leave the scene or who might stay, and that's just minutes that are, you know, wasted that are critical. And then, oh, sorry.
Oh, I was just going to say, we found out literally about 2 years later, just by chance, that the first officer on the scene was there with just a matter of a few, like less than 5 minutes. They were 2 blocks away at the UNCG police station.
When they were finally called.
When they were finally called. So had they been called immediately,
right,
might have been a different story.
And then this slide just shows, this is from the Government Accountability Office of the U.S. government did an assessment of Good Samaritan laws. And this just shows the states that protect against arrest and charge versus the ones that just protect against prosecution. So you can see that North Carolina is in the minority here. Most states are now protecting against arrest and charge because, again, if you can't prosecute somebody, like, why are we wasting time arresting them and booking them? And like Jordan said, you know, we have studies now that show that the only states that are really seeing a reduction in overdoses as a result of their Good Samaritan laws are states that are protecting against arrest in addition to prosecution. So that's also one of the things we're pushing for with this expansion of the Good Samaritan law. So folks might wonder like where this stands with the legislature. We have already reached what is called the crossover deadline. which is where a bill has to make its way and be passed in one chamber, either the House or the Senate, and then cross over to the other chamber. That was May 4th. Our bill, unfortunately, did not make the crossover deadline, and we know that the sheriffs and police chiefs associations had some concerns about this broadening, and we're essentially keeping it from coming out of committee. We're still working to try to have dialogue with them about why these changes are needed. And our bill sponsors, we have 2 Republican and 1 Democrat bill sponsor in the Senate. And they are still hopeful that we could tack it on to another piece of legislation or onto the budget and pass it that way. But we still need to be, having conversations with law enforcement, because as long as they just wield a lot of power at the legislature, and as long as they're kind of blocking this from progressing, we don't know that we'll be able to move it with any vehicle. So, one of the things that we're asking folks to do is to, if you can, have conversations with your local sheriffs or police chiefs about why these changes are needed. We did have a sign-on letter that more than 150 faith leaders signed on to. Maybe some of you signed on to that. I think we've been talking about also doing a new sign-on letter specifically aimed at sheriffs and police chiefs, so please stay tuned for that.
Can y'all share what the particular reasons are for being against the expansion from those particular groups?
They think that our law now is good. They're just not convinced that we need a change. They've said things like, well, we wouldn't really arrest people a lot of times anyway. And it's like, well, then if you wouldn't do it, let's put it into the law so that people will feel confident enough to call.
Safe.
Yeah.
And we do additionally know that depending on where you are in the state, people are being arrested, especially since fentanyl isn't included, and that is this is dominant drug, in our supply.
Does anybody have questions before we move on to some of the other legislation that is pending in the legislature? Okay. Other legislation. Jordan, do you want to talk kind of overall about what a little more about what death by distribution is and why we're concerned?
So, death by distribution, as we briefly touched on earlier, and you may also hear it referred to as drug-induced homicide laws as well. A lot of states had these laws on the book for a while, but they were not really used until, say, probably 2015, 2016. We started seeing an increase across the country of these charges being used. So it, comes down to, if I sell somebody a drug and that person dies as a result of that drug, if law enforcement can prove that I was the one who procured the drugs, made the sale, I can be charged with essentially homicide in that case. So the bill, and there's a House bill, there's also a Senate bill that are looking to reform the current law in North Carolina. And there's key issues in that is, so as Roxanne had mentioned in the proposed bill, delivering a drug, so essentially sharing a drug with somebody, can potentially be a Class C felony. It can be a Class B felony if it is delivered and they can prove that the person acted with malice. Class B felony of the sale for just selling, and a Class B felony for the sale of a controlled substance that was the cause of death, and if the person who sold the drugs had a conviction of certain controlled substance violations within 10 years of the offense date. So we know, broadening the law to include sharing drugs will increase overdose deaths because it will decrease, people will not call for help. If I know that I can potentially be charged with murder, I'm not going to call. And it will also increase how many people are being charged with this offense. Most often with controlled substance laws, a lot of it boils down to the weight. So how much was found on the person, how much of the drug. And what we're seeing is, especially with fentanyl, since it is more potent than heroin, they are proposing very, very small weight limit, essentially a gram. And it's not realistic. The narrative of, when we see news stories of, police in Arizona found enough fentanyl to kill everybody in the country. It's exaggerated, right? Because yes, fentanyl itself is very potent and can potentially be lethal, but there's, again, varying factors. Whether we're talking about somebody who is just experimenting or somebody who procures a drug, they don't know fentanyl is in it and they don't have a tolerance for opioids, then yes, right, like a gram could potentially be lethal. But when we talk about your daily drug user, so fentanyl, the high lasts significantly less than heroin. So therefore, once somebody develops a tolerance, they are going to be using more than 1 gram. For somebody especially who has a tolerance built up, 1 gram is very likely like what they're doing 1 hit at a time. And then so keeping that limit so low, we're not only increasing the possibility of laws like this, but now it's almost guaranteed that if I'm found with, say, 6 grams of heroin, which is maybe what I do in a day, now I could be charged with trafficking and all these other offenses. But the main being, this law will decrease people seeking help, and it will increase people being charged. Drug users share drugs.
Yeah, so just to be clear, this proposed law, it broadens the death by distribution definition. It also puts in this provision that would give Good Sam immunities for up to 1 gram of any drug. So they, again, why the police and sheriffs are saying that they don't feel like our law is necessary is because they're like, well, we've put in up to 1 gram in this proposal already. And as Jordan has explained, 1 gram for a person who is a habitual user is not, you're likely to have more than that on your person.
What's the point of them wanting the gram or the weight limits at all? I mean, is it just, are they trying to catch the bigger drug users?
So the original intentions of death by distribution, drug-induced homicide laws were to go after like the cartels and like your drug kingpins. However, that's not what's happening. These laws aren't taking down the Sinaloa cartel. They're not catching the next Pablo Escobar. They are ensnaring drug users, and they are also ensnaring low-level drug dealers. And adding on that, many people who use drugs also sell drugs. And there's a much larger conversation about how we talk about and define and look at drug dealers as well, which can be sometimes a difficult conversation to have. People have very strong opinions, but your low-level drug dealers are really victims of the same war on drugs. I was a drug dealer on and off for many, many years. And I probably very likely sold drugs to somebody who died off of that. But knowing that we need the protection, you saw the picture of my brother earlier. If the person who had sold my brother the drugs that he died from had also been arrested, I would have lost both my brothers, one to death and one to prison.
And one thing that I'll note with drug-induced homicide laws across the country, when those have been studied, we do know that there are disparities in terms of sentencing as well. So people of color are much likelier to have a longer sentence, statistically we're seeing, than than white people for when they're arrested and prosecuted with drug-induced homicide. I see that we're with 10 minutes. Randy, I just wanted to give you a chance to say if you wanted to speak about Vanessa's situation and in terms of how that relates to death by distribution.
So, anger is, as we all know, just a motivator in so many ways. And you might be asking why we have death by distribution laws, how they came about. When my daughter died, I wanted to see everyone and anyone involved in that thrown in jail for the rest of their life. I was angry. I'm still angry today, but in a different way. Had that happened, as Jordan just said, she would have lost both of her brothers. Well, it would have affected so many lives. And it took me a year. I can't go through the whole story because we don't have time, but I'd love to tell it at some point. It was divine intervention that things just lined up. The planets all got in the right place. And I sat down with the young lady that gave my daughter the drugs that she overdosed on. And we had coffee, 2 hours of crying and hugging and you name it. But she was my daughter's best friend. She would have never done anything to harm my daughter. She was not at the scene. Had she been, she would have dialed 911. No doubt in my mind. Kelly was severely addicted at that point to heroin and trying to withdraw on her own and was dope sick. And what she saw when my daughter got in touch with her and said, "Can you get me some heroin?" was an opportunity to get just enough to not be sick for herself. And that's what she saw. Long story short, Kelly went on to work for an organization that doesn't exist anymore, unfortunately, called Alamance Cares. She worked with at-risk, primarily female youth between the ages of 13 and 21, and changed lives, countless lives. Had she been arrested and thrown in jail, those lives would have never been touched, potentially. So this goes beyond that. And for me, I come from a place, hopefully, of compassion and forgiveness, because I know that the anger is going to not bring my daughter back, ever. So that's what I try to encourage others to do.
I know we're running short on time, and we do want to have some time for questions and discussion. I'll just mention that this is, so there's, Jordan talked about HB 250, there's also SB 189, one is a House bill, one is a Senate bill. They both widen the definition of death by distribution. This Senate bill also has some provisions that would increase fines for trafficking. And then there's HB 647, a bill that would expedite the removal of children from if children are exposed to drugs in utero. So this was a bill, it was proposed a few years ago. A coalition managed to defeat it. It's coming up again. And so it would make exposure to illegal drugs in utero grounds for child removal. It would decrease efforts to keep parents and children together, and it would make it easier and quicker to terminate parental rights. So, some points about this: Department of Social Services, they already have the ability to substantiate allegations of neglect, but we don't think it should be presumed that all pregnant people who use any amount of a controlled substance are automatically neglectful parents. And we know that these types of laws drive people away from seeking prenatal care. They drive people away from seeking treatment. And DHHS has a statistic right now that only 89% of people in North Carolina, or 89% of people in North Carolina cannot get the drug treatment that they need. So we know that drug treatment in North Carolina is terribly hard to come by, especially, quality drug treatment. So, we would argue that instead of making laws that remove children from parents more easily, that we should make it easier for people to get treatment, make it more safe for people to come forward when they need to seek treatment. We also know that women of color are reported for substance use in pregnancy at much higher rates than white women. There was a study in Florida that showed that they were reported at 10 times the rate, not because they're using more drugs, just because they're more apt to be reported. So we know that if this law passes, it will likely have a disparate impact in North Carolina in terms of which children get removed. I'm sorry to rush through that. We have 5 minutes left, so.
And we can share these slides with any of you, and also any informational, like, studies, anything that you would like. You know, you can have our contact information, and we can share all of that. And so we'll do questions, and I think just quickly we touched on, you know, the war on drugs, and if we look at the last 50 years of policy and our approaches, we continue to take punitive criminal responses, and it does not work. Prohibition is why we are in the situation we are with a very toxic drug supply, and it will continue to fuel that. And this is a public health crisis that needs to be met with a compassionate public health response. Questions?
What was the Senate bill you mentioned?
The death by distribution one,
Yeah, what did the
Senate Bill 189.
Thank you.
How does being a minor versus being adult play into any of these?
This is a great question.
It is. So, I mean, I know off the top of my head, one, depending on the age of the minor, you know, whether or not they can be charged as an adult or a juvenile, and also looking at one, we don't have adequate resources for adults, and we have even less adequate resources for adolescents. So oftentimes, especially if you have an adolescent that is sentenced to complete treatment, they're often going to sit in juvenile detention until there's a bed open, and that could be 6 months, that could be 18 months until they're able to access that.
Yeah, did you have a question?
This is less a question more than a fact, but I feel like the one on pregnancy is especially stupid because the reason they're on drugs while pregnant is probably because they're pregnant and occasionally in great pain.
Could
I
be.
feel like that could be
That
obvious,
could be.
and yes.
That's a good point. We're going to bring you with us to the
Yeah.
Capitol.
Which is another reason why people should feel free to be able to be honest with their doctors.
Yeah.
So can y'all just address really quickly, are there any efforts at all to look at expanding services like medication-assisted treatments with a lot of the opioid funds coming into the state? 89% of people can't access treatment even if they wanted to.
Well, yes.
Right.
So
Right.
that's a great point. I mean, one thing is with Medicaid expansion, I think that will open up the ability for people to be able to access treatment. There's also the need for more treatment providers. But yes, you mentioned the opioid settlement dollars. So North Carolina is getting, I think it's $750 million dollars in opioid settlement money. So this is states and localities, including our Attorney General Josh Stein, have been quite aggressive in going after drug makers and pharmaceutical distributors to get money from them in settlements to make up for the damage that they caused in over-marketing of their drugs. So, you know, they won settlements with various companies, will be getting a lot of money over the next 18 years. And so there's been a push to say, you know, that money really needs to go to things like evidence-based treatment, which there is like a huge lack of. So instead of, you know, kind of playing whack-a-mole, trying to always go after like the next substance that comes up and criminalize it and criminalize people who use it, like could we just make sure that people who need treatment and who want treatment can actually get treatment? So yes, the settlement dollars are an opportunity to advocate that money should go towards treatment.
Something that I think is underreported or underestimated as far as numbers is the mental health crisis, and how the mental health crisis is leading to the drug crisis, is leading to the suicide crisis that we're seeing. So I mean, it all has to play into a part of the big equation.
And I'll just add to, you know, like neatly wrap up, since you mentioned like the settlement funds. There's really an opportunity for North Carolinians to get involved, to demand accountability, to demand transparency. And I think as faith leaders in your community, this is an area to help facilitate those conversations where you live, you know, to make sure that the funding is not spent on law enforcement or not spent on services that we know are not successful. And yeah, and just really, you know, hold our officials and, you know, people in positions of authority accountable. Because again, politics it infiltrates everything, and there is so much about why we don't have adequate resources. So that boils down to politics.
And since this is a legislative seminar, I'll mention that, you know, 15% of that opioid settlement money is allocated through the state legislature. It's allocated through the state budget. Right now the proposal is most of that to go through the Department of Health and Human Services, which is good. But 85% of that money goes to counties. So for sure in the counties that you live in, they're having conversations about how to spend that money. So yeah, make sure you're at the table for those conversations, because that's a lot of money. And Nicole's handing out just an info sheet that we have about expanding the Good Samaritan law in North Carolina. But thank you so much for coming, and we'll just hang out for a few minutes in case anybody has any additional questions or wants to chat.
Yeah, I want to just to Nicole's point about the funds. One of the things, I had so many things on that list that I'm involved in. It sounds like I never sleep, but I'm now working with the Alcohol and Drug Council of North Carolina, answering phones and helping people find resources. We need more resources desperately in this state.
Yeah.
So.
Great.